Good afternoon. Welcome to Wednesday Live with me, Vinod James. Welcome to Neethus Academy Reading Live. Days just goes very, very, very quickly, isn't it? I just told you Monday. Now it's already Wednesday. So you're all eager, waiting for all your big day to pop up. You know, all those things are happening, isn't it? And a big week coming. A lot of holidays for each one of you. So make use of all those things that is going to come your way. You know, when you get such a kind of holiday, relax, spend time, enjoy. Weekend, isn't it? So that's how things would work for all of us, isn't it? We have to make use of whatever the opportunities that is going to come our way. So as what you're all going to do, tell me, how are you all doing? All are doing good? Yes. I'm sure all of you are doing good, isn't it? Right, Jilmi, good afternoon. Very, very, very good afternoon to all of you. Come what may, no matter wherever you are from, a very good morning, a very good afternoon, and a very good evening to all my lovely students. As students are piling up, what is Neethus Academy? What is Neethus Academy in store for you? We do give training for a lot of linguistic exam. If at all you want to know what are the things that we do, what are the things that we can offer you, you're always welcome to contact the number which is there on the screen. They will be happy to assist you. Okay. So we always boast, we know that the students make that difference in what we are. So the number is 97479444374. So if you want any insight, you're always welcome to contact them. Lima Thomas, good afternoon. And we have few social media platform that we are very, very prominent in. If you really look into the Telegram pages, we are always there, hovering about nearly to 50K. Thanks to all of our students. Those are lively students who are there, who want to make that difference. If you really look into the very same page that you're watching, we have every day, we improve our likes, we improve our followers. So it's all because of you all. Kavita Balaji, good afternoon. And we have improvised on a lot of things. If you really look into a lot of linguistic exams that we are now doing live. So if you're still not aware, do not forget to click the like button. Do not forget to click the share button. Do not forget to click the subscribe button. Do not forget to click the follow button, so that you will never miss whatever that we are going to come in front of you with. Okay, we come with a lot of live sessions these days. So do not miss. Okay, so these are all there available. So up to you to decide when you want to watch. Yeah, Alan Maria Jomon, good afternoon. Sharanya Rakesh, good afternoon. So happy to see at least one icon next to your name. It can be a hand, it can be a heart shape, it can be a flag, it can be the number 2 logo, it can be the number 1 icon, anything. You can be the human which is having a share button. And one small request from me is, if you feel my classes are benefiting you, please do not forget to click the share button. Please do share on your social media platform, because there are n number of students who are still unaware that we do give a lot of free sessions like that. So they can also have an impact. And they can also reach their dream country, isn't it? Not only that you reach, you are aiding the other person to reach as well. So what nobility. And they will always bless you for that also. G.I. bin Maldives, good afternoon. Jansi Gigi, good afternoon. How am I? I'm doing excellent, Jansi. Thank you very much, and I hope you are doing well as well. Good afternoon to Reshma. Okay, fair enough. So as you know, there are a lot of fraudulent people available because it's an online platform, isn't it? So make sure that you are aware. We will never send you any message. So if there is anyone who is sending the message, please do click the report button and block them. That's the only thing. We have to be smart enough, isn't it? Those people, they are trying to outsmart us. We will outsmart them. Be cautious with those kind of fraudulent people. So do not respond to any messages that is going to come your way. Just report them and block them. Okay. Nisha Keynes, good afternoon. Very nice. So tell me, what are your plans for this big day? Big week, I'm sorry, not big day. Big week coming in, isn't it? What are your plans? Let me see what are you all going to do. Are you all eagerly practicing for the exams that is going to come after the very next day of that big week, very next week? Preeta, good afternoon. Nice to see a lot of people. Sharanya, okay. Grishma Devasya, good afternoon. Right. So yesterday I was talking about on few days. So ever since we started 2024, we've been talking about the impact of how to get or how to manage 8 minutes, how to get 20 out of 20, how to get 400 out of 400. This has been our agenda for all these while, isn't it? So what else are you going to do? How can you improve on things that is going to come your way? What are the things that we have to do to enhance certain things? We told you the importance of, what can you say? We told you the importance of reading as a habit. That's the fundamental thing. Eva Ivan, good afternoon. Tiara, hi. Lot of new names, known names and few new names. If there is anyone who is attending the live for the very first time, please do let me know. I'll be happy to know where you're from as well. Annette Seto, good afternoon. So a lot of prominent names, a lot of known names, a lot of new names as well. Abhi Rajan, good afternoon. So is there anyone who is attending the live for the very first time? Really am missing your intro classes. Reshma, very sweet of you. Thank you so much. But generally, my students are always afraid, isn't it? But so happy that you are missing those intro classes. But I'm here in front of you. Tiara, good afternoon. Bright Hero Simon, good afternoon. New name. Is there anyone who's attending the live for the very first time? Anganaringlondo. Adhyamaita live attendee. If so, please do let me know that you're attending for the first time, and also do let me know where you're from. Yeah? Nice to see a lot of profound names. I would always remember, I would always recall a lot of names which the students who have come through me, through intro, through my live classes, and of course with your active sharing that has been happening. There are a lot of new students every time. Okay, so on behalf of Neethus family, I would like to thank each one of you for all those lovely effort that you're doing. Tiara, today part very difficult, very, is it, Tiara? Let's see. See, I'll give you another clue. See, whenever we talk about being difficult material, isn't it? Go back to your exams that you've written and see, when you say the exam was difficult, did you score more mark? Or when you scored more mark, when you said it was easy? Monica, definitely no, sir. Finally, it's all for our good. Okay. Thank you very much. Monica is also one person who have gone through me, through my intro, isn't it? Okay, fair enough. Highly appreciated that you knew why. See, end of the day, our job as trainers is to make sure that you're all benefiting. In order to do that, we have different strategies that, we do. We have a back-end strategy and we know that it is working. But, it takes time for certain students to realize it. But of course, we know that they will definitely realize it. All right, thank you very much for all those support. Rini Mol, good afternoon. So I haven't seen anyone telling me that you're all new. All new in the sense, anybody who's attending the live for the very first time. So I think that all of you are there on or before. Right, yesterday we spoke the importance of how to read. Okay, so when you're reading, say English, you have to understand, unlike our native language, it's not something that you read word by word. Angelina Mole, good afternoon. So you need to club it together to make sure that you understand the meaning. Okay, it is very much of a different kind of way. See, and whether you like it or not. Manisha Sunil, good afternoon. Nice to see a lot of people in front of me. Okay, so you have to always remember, English is a language where you'll start understanding when things work together, when they start rhyming it together. Okay, just to give you a clue, just try to read a sentence word by word with the absolute pronunciation. Bibin Thomas, good afternoon. Let's see if you are able to understand what you read. You will never be in a position to even understand anything that you have read, even though you would have, or ask someone to read like that, so that you don't know what you're reading. And then ask someone to read by clubbing it together, you'll definitely feel that difference. Okay, so these are the things that you have to really work on. So don't read English word by word. Word by word you will never understand. And word by word meaning is not at all what the whole idea when you read passage. So that's the clue for today. Alright, I hope I am benefiting each one of you on a daily basis, which I would definitely see on your results, isn't it? Your commitment towards us is to get such great scores, which our students have been getting every now and then. They do come up with such a kind of, I would say, stunning scores. Okay, there are students, I'm always proud of students who score absolutely stunning in writing, because writing was always a horrendous task for me. But there are students who literally score about 430, 420, 400, 410, even 350 to score is an absolute stunner. Okay, so one of my students, like when that student scored 430 and all in writing, I absolutely appreciate those kind of efforts, isn't it? It's an absolute, standalone kind of achievement. Right, so without wasting your valuable time, let's go and dig it. And what you're waiting for. Are you all ready for today's session? If so, give me a quick thumbs up. Reshma is also saying yes. Okay, good enough. Are you all ready for today's session? Yes or no? Let's see how many of you are eagerly waiting. Because you have to understand, as I always believe, see the students, how the student responds is how the trainer would respond. There's always a give and take, isn't it? We come with a lot of energy, and if you don't give us that energy, we also will have a subdued kind of emotion. When our students are active, we will also become active. That's how it is. It's a give and take, yeah? So no matter wherever you're going, you have to be active enough. Actively participate. That's the reason why you've been asked to comment. Okay, when you comment, it's more energy for us. Those are the catalysts that needs us. In between, you need those kind of catalysts. And you all have been stunning catalysts for us. Vibin, yes. Angelina, yes. Monica, yes. Rinimol, yes. Brighty, yes. Nisha, yes. Kavita Balaji, yes. Shiny, good afternoon. Preeta, yes. Jansi, yes. Lima, yes. Sharanya, yes. Jia, yes. Ready. Alright, because you all said you're all ready. Now the material will be popping up on the screen, and as I've mentioned, we are trying to do certain things. We're just giving some experiments on the aspect not to display the timer. And I'll be monitoring the time, and you will be only set start. And your job is to make sure that not to see any time. You are having, even though yes, you're very cautious on the aspect of time, but you don't know what is the time. Okay, I'll be the one who will be monitoring the time. And as soon as I say done, before that, your job is to Dharmozin, the gentleman from Kashmir. Now he is very much prominent. I appreciate your saying of Namaskaram, isn't it? So it's Namaskaram, but absolutely good enough. Hats off to you. Yeah, good enough. Right. So the material will be popping up on the screen, and as soon as the material pop up, I'll be the one who will be clocking in the time. Your job is to tell me on or before. As soon as you find an answer, just put a thumbs up or say done. The material is going to flash from your screen, and I will be one who will be monitoring. There you have, and your time starts now. Right, time is done, is it? But I couldn't see anybody telling me that you've done the answer on or before time. Did you all do on or before time? Yes. I hope all of you have an answer with you. Yes. Done, Monica. Okay, the first one to tell me that yes. Good enough, good enough. Anybody else who have all got the answer? Shiny done. Okay. Jia done. Good enough, good enough. Grishma done. Alright. Litti Mochako done. Reshma done. Right. Abhirajan done. Ilakya done. Bibin Thomas done. Good enough. Good enough, good enough. Right. I know that not all of you have told me that you have done, but of course, people who have told me done, absolutely good enough. Now, would you be kind enough to tell me what is your answer and where you got that answer from? Would you be kind enough to tell me what is your answer and where you got that answer from? That where is very important. You know why? Because, see, we know that we all have a different comprehension skill, isn't it? We can get the answer from somewhere. So it's not really something that you have, everyone will have from the very same place. So I would definitely want to know where you got the answer from. It's not about, oh my God, am I going to tell the right thing? See, the first and the foremost thing, as I've told you, it is your active participation that makes the life even more lively. Okay? Grishma, I got C from the fourth sentence. Thank you very much. Littimol is saying C. Okay. Jilmi is done. Fair enough. Reshma is saying C. Okay. Now where you got that answer from? Like Grishma said, fourth sentence. Fair enough. Littimol is saying last line. Okay, fair enough. Shiny VS is saying C from middle line. Okay, fair enough. So the general answer is C, isn't it? Most of the students have started saying it is C. Is there anybody who have got any other answer? You're always welcome, okay? Do not worry about whether, oh my God, all of the others are saying C. It doesn't matter. Okay, Shiny is also saying, okay, fair enough. Anybody else with any other answers? Ilakia is saying C from the last line. Okay, fair enough. So, whomever have told me, they're predominantly saying that it is C. Kavita Balaji is also saying C from middle. Monica Vegas is saying C from the overall, just especially on the last three lines. Okay, fair enough. Even more precise, isn't it? Good. See, this is how you should enhance your learning. Wherever you have got it, it's your right to say, I got it from here. Fair enough. Okay, Angelina, I always love a student who has the ability, when all the others are going against you, I have got B. Happy? Because B, you got it from middle, isn't it? There are students who have got C from the middle. So these are all possibilities, okay? You have to understand that. So it's not bad to tell whatever that you have got. Because we are here to learn. And our job as a trainer is to what? To correct you. That's all. Isn't it? So now the material will be popping up back on the screen, and as the material pops up, I'll be talking about what are the important things that you have to do. So we have C and we have B. Now first and the foremost important thing when you do in a material is, let him also, I think option B is not given and A is not correct. Okay, fair enough. Let's see. Okay, it's not a problem. Now, if you really look into, see, the first and the foremost important thing is about doing three things. Okay, and barring the strategy. What is the strategy for part B and C? It's called elimination method. Okay, and what are the things that you have to really look into? First and the foremost important thing, read the question. Please read the question. As you read the question, underline the keywords of the question. Understand the question. Okay, initially, see, these are for newcomers, people who are doing new. What you do is, once you get the answer, go back and see whether it is addressing to the question. That will give you a lot of clue. Yeah. Now see, in patient taking medicine, so patient taking medication described below. Now this is again an open kind of question, isn't it? You have to read along with that. Describe below the risk of developing. So risk of developing secondary leukemia is 1.6%. So the risk Developing 1.6%. Described below, the risk of secondary leukemia outweighs the benefit. So risk outweighs benefit. Those are my keywords. Described below, the risk, again, see, the risk is not a problem. Developing. So one is, all those things also has developing. So developing secondary leukemia increases with time. So one, they are saying it increases by a very precise of 1.6%. Second, they are saying it outweighs the benefit of taking medication. Or does it increase with time? Understood how you differentiate? See, the risk of developing secondary is almost there in every sentence. So that is all, is okay. So 1.6% outweigh benefits, increase time, if you really want to know. Now what you do, after doing this, you go to the paragraph. So secondary acute myelogenous leukemia, AML. Reading. Secondary acute myelogenous leukemia has been reported in multiple sclerosis and cancer patients treated with methotrexate. Okay, so this is about some particular medicine, isn't it? In a cohort, see, now this is a beautiful word, okay? You have to be very cautious, especially in C. Cohort means something where you're pre-selecting the patient. Okay, only that particular condition kind of patient are being selected. So in a cohort of methotrexate treated with MS, okay, patients followed for varying periods of time, an elevated leukemia risk of 0.2%, 2 out of 8, not 2, has been observed. So varying period of time. So something they're talking about, referring to a time, okay, has been observed. Post-marketing cases of secondary AML have also been reported. Okay, so they are saying, yes, not only that, something else also have been reported. Now, in 1774, that means in 1774 patients with breast cancer who received Noventrone, so they were talking about one in here, now they're bringing another, concomitantly with other cytotoxic agents and radiotherapy, the cumulative risk of developing treatment-related AML was estimated as 1.1% and 1.6% at 5 and 10 years respectively. See warning section. Okay. Now, the risk of developing secondary leukemia is 1.6%. Anywhere? Not there, but 1.6 is mentioned. So, developing treatment-related AML was, so this is a straight eliminator. Now, secondary acute myelogenous leukemia has been reported in cancer patients treated with anthracyclines. Novatorone is an anthracycline, a related drug. Now, I'm just going to remove all these markings, okay, so that you understand. Now, 1.6% is a straight eliminator because it is not mentioned. Now, see, outweigh the benefits. What benefits? When you take medication described below, the risk of secondary leukemia outweigh the benefit. What benefits when you're taking medications? No benefits. Okay, and it's not about comparing whether it is benefit or it's not mentioned. So development, it increases with time. So cumulative risk, and it's as what we said, in a cohort, what happened? Varying period of time is one place which is talking about time. And then as observed, then they are saying in 1700, who are taken concomitantly with other, a cumulative risk of treatment-related AML was estimated about 5 to 10 years. Again, it's the time duration they're talking about, isn't it? So everything is talking about C only. So congratulations for all of you. Right answer that you have got. And people who have got B, doesn't matter because you just went on the aspect. There is no benefits, isn't it? See, benefit, risk of secondary leukemia outweigh the benefits. No, the risk of it's not going to benefit anything. Clear? Abhirajan is happy, good enough. Reshma is dancing, excellent. I always love when a student enjoy their achievement. Good enough. Kavita Balaji is dancing, absolutely good enough. Monica is dancing, good enough, good enough, good enough. Keep on dancing. Very good, very good. Any doubts with regards to what I've just told you? Anything that you're not sure about? Anything that you want me to clarify? No, Tiara is happy. Good enough. 𝐉𝐵IN is dancing. Good enough. Keep on dancing. Very good, very good. Angelina understood. Good enough. See, I absolutely appreciate you, isn't it? When others are saying something different and you have that courage to. That is that fundamental thing of, because a journey of 1,000 miles starts with a single step. You have taken that single step now. Because you were not afraid to tell what you have got. Good enough. Abhiraj and clear. Right. Because there's no doubts, or all of you are saying clear and all of you are enjoying. Now let me take you to your next content, which is part B. So the name was very, very nice. It's more like somewhere from Germany. Yeah? The name of the material was Schnitzler's syndrome. Okay? Now, I've told you the name, and I have got few insights from few students saying that it was very tough, very difficult. See, it's all because of that mindset, okay? You have to really understand. Maybe because it's a name which is not as common as what you have. How many of you have heard this word before, or the syndrome before? Anybody who have heard this syndrome before? Tricky material, 12 minutes, Jilmi, absolutely good enough. How many of you have heard about this syndrome before? Anyone? I have never heard. So, I'm not the prominent person, but out of all the materials that I've done so far, I've never heard such kind of material. So, it was also a bit, like that mindset comes, oh my God, I've never heard about it. I don't know anything about it. That is where that thing goes wrong. See, you have the right strategy. You have the right way of doing it. You know what to do. You know what are the tips and tricks. Then why do you worry? Come what may, you have to, all my students should tell from today, no matter whatever the material is going to come in front of me, I have the equipment to tackle it. Isn't it? Shiny is saying first time hearing. Tiara is saying yes, first time hearing. Good enough. See, this is where you have to start molding, and that is where we are here to mold you. You have to say, I have all the thing that is there in my armory which is needed. I have all the strategy, I have all the ammunitions there in my armory. It's there. I have everything. Okay, you give me another topic which I don't know, no problem. I know what to do. I know how to refer the keyword. There will be a word which I will get the answer. That should be the thing. Understood? First time hearing Kavita. See, good enough. See, as I mentioned, most of us would have heard about this the first time. So that has shifted that thing between tricky or whether it was challenging. Understood? So do not worry. Now let's see what are the answers that you have got and how much are you going to score. You see the difference between that small psychological shift. Right? But most of you are saying with stunning times. Kavita Balaji is saying 11 minutes and 32 seconds, very precise as always. Jilmi is saying 12 minutes. How about others? How did you feel about today's material and how many minutes you took to complete today's material? Tell me. Let's see. How many of you feel what about this material? The one thing I found it difficult was to pronounce that syndrome. Okay, because for me it's always, the German language is a bit difficult to pronounce because it comes from using a lot of throat. It's the same with Russian as well. You have to use a lot of throat. I'm not a person who uses a lot of throat. Right. So, I think you're all ready for part A. The material will be popping up on the screen, and as soon as the material pops up, we'll be discussing. 𝐉𝐵IN is saying 15 minutes tricky. Alright, fair enough. See, you have to start validating where you stand. That's the fundamental thing of learning. Okay, so part A is the first material that is going to come your way when you go and do your exam. So you will only have 15 minutes. And in that 15 minutes, you'll have to tackle 20 questions. And these 20 questions are divided into 3 types. So what is the strategy? Strategy is called skimming and scanning, unlike part A. So what do you do? Scanning, you're very profound with that, isn't it? You're going to check in detail. Skimming means you're going to quickly look. So when you're doing, they say 1 to 2 minutes, but I say take only 15 seconds. That's more than enough to skim each text. And when you're skipping also, you have to know what are the words that you have to underline. That is what it is. Fundamentally, it is just purely keyword reference using a lot of synonyms. It's purely synonyms languages that they're going to pump you with. And we have committed, we've done a lot of things on the aspect, at least one word at a time, a minimum, to make sure that you're getting exposed to such kind of wordings. Lucky I took 13 minutes. Fair enough. Now let's go and do the skimming. I'm just going to show you how to skim. I know that you know, but still. Okay? The more you repeat, the more better you become as well as I become. So, Schnitzler's syndrome is a rare disorder characterized by the chronic reddish rash and resembles hives at the EU-triad carrier, an elevated special protein on the mononuclear IgM. The symptom is repeated both fever, joint inflammation, joint pain, bone pain, lymphoedema. Monoclonal lymphoedema is controlled in single clone plasma cells and the abnormal accumulation of M protein known as immunoglobulin and IgM and the other way in the blood. Protein plays an exact unknown is difficult, and some research have suggested that an acquired inflammatory and autoimmune so it is categorized in innate immune system. They are not an autoimmune disorder, an adaptive immune system malfunction and mistakenly attack health issue. Done. Did you know what I read? Did you understand what language that I was talking about? Even though I was reading English only. Dinesh Verma, hi, new name. Right. Likewise, you'll have to do each text. Now, this is another interesting thing why you have 2 images, isn't it? It is possible. They say a minimum of 1 can be image. It can be 2. Right? When image comes, you have to be a bit more cautious about it. So this is talking about a lot of criteria. Yeah, both required, a lot of criteria, diagnosis and all those things. So you have to go through it. And then you have a study, 253 patient and all those. So anything with study, go here. And then you're talking about treatments. So anything on treatment, go D. Anything about study, go C. Anything about diagnosis or criteria, go to B. And just an overall perspective, go A. This is how you differentiate. Understood? You should be able to differentiate this. Then go to the question. As I've mentioned, 20 questions, 3 types. 1 to 7. This question type of question and instruction should be by-hearted by each one of you. That is one request that I have. Don't waste your valuable time reading the instruction. 1 to 7, these are called match the following question, where the instruction clearly says you may use any of these letters and these letters can be used more than once. So you're only expected to find which text these thing goes under. That is why 1 to 7 is a piece of cake. 1 minute is enough for you to complete. I'll show you why. If you underline the keyword and refer, more than enough. Now see, criteria, other than the major being evaluated as an evidence of Schnitzler. So criteria where? I told you, criteria is mentioned where? Criteria is there, diagnosis is there. So the answer is B. Understood how you refer? Clear? So evidences that have been considered as minor criteria, as criteria other than the major. Other than major means what? Minor. See, if you're confused, minor. That's it. Clear? Now I hope all those confusion have gone. Major is not mentioned is what you're going to think. Other than major, minor. Done. Now, the definite assessment yardstick to confirm Schnitzler's syndrome. So yardstick, diagnostic methods, all those things. Again, where? In B. Why? Definite diagnosis. So that is it. So again it is B. See how you're referring? Why is it necessary to conduct follow-up? Follow-up, I know that it should be there under D, isn't it? After treatment only you'll have to do the follow-up. So definitely it should be D. Now is there anything mentioned? Yes, in most it requires a follow-up because of the increased risk of developing cancer. Done. D. I told you how you refer. Now see, again, criteria for selecting patients. Now see, selecting patients for inclusion in the study group. It's not just criteria, study group. So where is study group? Do you need a second option? C. Isn't it? Now where do you get that? Criteria for inclusion. Done. Primary therapeutic intervention utilized. So primary therapeutic treatment. Do you need a second option? D. That's where the answer is. Age bracket for eligible students enrolled in the study. Again, sorry, I missed 6. I'll just come back to 6. So the answer is, C, age bracket. It is there, isn't it? Here, greater than or equal to 18 years. Now question number 6. What set autoinflammatory syndrome? Autoinflammatory, when I was skimming, I knew it was there in A. So where is it saying? See, autoinflammatory syndrome is a group of disorder characterized by recurrent episodes of inflammation due to an abnormality of the innate immune system. They are not the same as autoimmune disorder, in which the adaptive immune system malfunctions and mistakenly attack health tissue. That's where the difference is. So A. Clear? Good enough. Now the next set of questions. So the instruction, again by hearted by each one of you, 8 to 14. These are called short answer questions, where the instruction says it can be a word, short phrase, word or numbers, or both. Grishma 7 out of 7, Abhirajan 7, Kavita Balaji 7. Very good. You are the people who said it is tough, challenging, tricky. Good enough, good enough. Keep it up, keep it up. Good going, yeah? Now let's go. Strategy doesn't change. See, this is why you have to know how to set your base. You have to have the right strategy. Once you follow the right strategy, come what may, it will be benefiting you. I think maybe you're not able to get a clear idea about what I'm writing, so I'm just going to make this a bit more darker so that you will understand. Right. A lot of 7. Bibin 7, Preeta 7, Jansi 7. Excellent. Keep it up, keep it up. Ashwati Vijayan, good afternoon. So next question. How much? So this is another keyword. How much? These WH questions, you have to be very careful. We say WH questions are 1 husband and 5 wives. So you have to be very much aware of it. What are they? How, why, what, when, where, who. Yeah. So these are called WH questions. Now, how much should be the minimum C-reactive protein? Ashwati Vijayan, 7 out of 7, absolutely good enough. To diagnose. So where is diagnose as a word? Where? Go to B. Now diagnosis here. Yes? So C-reactive protein is there. Yes. So how much is there? 30 mg per liter. That's it. The answer is 30 mg per liter. Now, which diagnostic technique will reveal the evidence of neutrophilic dermal infiltrate? So very specific, isn't it? Where? Go B only. Again. Because neutrophilic dermal infiltrate. Which is the diagnostic method? Skin biopsy. So SKINBIOPSY. The necessity of vigilant monitoring of Schnitzler's syndrome is emphasized by the fear of onset. Onset is a very prominent word which keeps on coming in a lot of C. Onset means beginning of which condition. So some condition should be started with the vigilant monitoring. Which one? Go follow up and all those things is mentioned, isn't it? You just read that follow up. Correct? What is a follow up needed for? Because the condition you might develop cancer. That is why you need careful consideration after cancer. Good enough. What investigation was previously conducted in 3 joint areas that were excluded? So excluded, inclusion and all those things where? Is there in C, isn't it? Now go to C. Now excluded 3 joint area with previous arthroplasty. ARTHROPLASTY. Straight. Now, which medication? When medication is there, go where? Go straight to D. Is employed to inhibit the function of interleukin 1. Go D. Where interleukin? Yes, interleukin is there. So, anakinra or anakinra, ANAKINRA is a drug that blocks the activity. That's it. Hinder, block. That's another word which you have to, I forgot, or inhibit. That means it's going to restrict. Good enough. Total number. Total number where? Go C. Because eligibility criteria. Go to C and C. Eligible patient total number is 94. 9 and 4. Good enough. Now, which specific protein? So I read protein in A, which is from my vague memory. This is how you gauge. Okay, exhibits elevated levels of blood, results of Schnitzler's syndrome. So go to A. What is the elevated protein? So elevated level of specific protein in blood is monoclonal IgM gammopathy. So monoclonal IgM 𝐲𝐉𝐵PATHY. Now the final set of questions, these are called fill in the blanks question, where the instruction clearly says it starts from 15 to 20. Very similar to short answer question, the instruction, but you have to be very careful with redundancy. Article repetition you're not supposed to do. Fair enough. Abhirajan is also 7. Good. So abnormal bone remodeling without accompanying dash can be deemed as a minor criterion. So minor criterion means where? Go straight to B. Now see, what are the evidence of abnormal criterion remodeling with or without bone pain? So it's a 2-word answer called bone pain. So the answer is bone pain. It's a 2-word answer. Syndromes like dash disorders manifest a collection of characterized by repetitive episodes of inflammation which stem abnormalities and innate immune system. So where are they talking about all these? I know that it is there in A. Immune system and all those things are mentioned in A only. So what is that? It is clearly saying autoinflammatory syndromes are a group of disorders characterized by repetitive episode, abnormality, innate immune system. So the answer is autoinflammatory. AUTOINFLAMMATORY. Because syndromes is already there in the question. That is the glitch there. You have to always see. Fill in the blanks means you are only expected to fill what is missing. Right. Rapid and dramatic improvement of both rash and systemic symptoms were achieved through the administration of a drug. So drug means go to D. Now what is a drug? Now go and scan. So systemic and all those things has to be scanned. Now go and see where is it talking about. So 11 affected individuals received pefloxacin, which cause rapid RAM. All those other keywords are there. So PEFLOXACINE, the answer. Those encompassed is a very beautiful word and very prominent in research. It means include. So you have to be cautious. Those included within this group also include individuals diagnosed with. So something where diagnosis and all those things. So go to C. Those included with this, which one diagnosed with? Rheumatoid arthritis. RHEUMATOID ARTHRITIS. All the others are not there in inclusive that. So this is how you refer with the keyword. Okay. So a fraction of cases saw efficacy. So efficacy again a very prominent word such as in efficiency and all. So efficacy. Okay. In treating certain individuals with Schnitzler's syndrome through use of dash and dapsone. Very good. Monica has already said the answer. So again, medicine where? Medicine is only in D. So here they are saying all those high doses regimen in small percentage. So colchicine, COLCHICINE and dapsone. The other explanation is not there, so you don't need that as well. So the penultimate question for this week, okay, because we're going to have a great long weekend. So in the context of monoclonal IgM gammopathy, there is proliferation of monoclonal dash leading to anomalous buildup of M protein. So where are they talking about? Definitely in A, isn't it? So where are they talking about? M protein and all those things. It is there in a monoclonal gammopathy, uncontrolled plasma cell resulting in the abnormal M protein. So what is that? A single clone of which one? Plasma cells. So PLASMACELLS. So I have finished my 20. If you have any doubts, please do clarify. If not, do shoot. What is your total score? Very good. All of you have, whoever have written, they're saying right answers and also we expect surprises from you. Tell me, what are your scores? If you have any doubt, you're always welcome to clarify. Please do let me know what are your scores. Abhirajan, stunning, 20 out of 20. Very, very good. Shiny, 20 out of 20. Stunning, excellent. Keep it up, keep it up. So remember I told you when you start saying tough, you're always surprised, isn't it? Bibin, 17, good enough. Jansi, 19, good enough, excellent. Keep it up. Good. Angelina, 17, good enough, keep it up. Good. Right, and I would like to remind you that May, June, July admission have started. So if you want a professional approach, you're always welcome to give us that opportunity if you feel that we can be that significant bridge between you and your dream. Right? So as I mentioned, it's going to be a long weekend because I'll be only seeing you next month. Why next month? Because the next month is right around the corner, isn't it? So until and unless I catch you all next month, happy Easter to all of you, right? May you have a lovely weekend. Do enjoy your holidays until and unless I meet you all in the coming days. Adios from me. God bless you all. Take care. Bye.